morning. Thank you, Chris. I'm Ruth Wickens and I work as a clinical nurse specialist at the Wellington Blood and Cancer Centre in radiation oncology, so looking after patients having radiotherapy. You've had an introduction to Nick, but I'll let him also introduce.
And I'm Nick, and thank you for your kind introduction. Thank you. And yep, it is a partnership. So Ruth didn't make the paper, but we're a team, and we're going to give you a bit of a team prezzo today.
And the title of our presentation is From Distress to Inspiration. And our journey starts around head and neck cancer, which is something that Nick's experienced. For those of you who don't know what head and neck cancer is or means, it's basically anything from here to here. So cancer of the tongue, the tonsil, the mouth, the throat, this really important part of our body that we can't do without. The treatment journey for patients can start with surgery, and in Nick's case that was a major operation, and then can go on to have radiotherapy and perhaps chemotherapy as well. Some patients only have radiation treatment, some have radiation and chemo together, so there's a bit of there's a few different ways that this can be approached. But regardless, treatment is incredibly arduous, difficult, and it really takes people a year, sometimes longer, to recover from it. The side effects of radiation treatment, just forward to a slide actually, skin reaction, so like a bad sunburn on the head, the neck area. Sometimes people need dressings. The same sunburn on the outside happens on the inside of the mouth, so if you can imagine a mouth full of blisters and ulcers down your throat as well. Can be incredibly painful. People often need high doses of painkillers even to just swallow. Taste changes, things taste revolting or just of nothing at all. Swallowing function can be impaired, and a lot of people need a feeding tube, to be able to simply bypass this part of the mouth and throat that's so sore and get food directly into the stomach. They get tired, and there's many more. In the slide you can see that's actually a picture of Nick when he was having his treatment. There's a plastic mask being put over his head, and that mask is to hold the patient in exactly the same position for treatment every day for radiotherapy. In that photo the mask isn't quite clipped down into position. You can see a gap under the collarbone area, the chest area. When that's clipped onto the bed, that would be very firm around the neck and the shoulders, and the patient couldn't move at all. So that's the background to the story, and now we'll move on.
Thank you, Ruth. Actually, I was going to go first on this bit, and then you were going to chime in. Is that right?
Yes.
Great. Oh, that's good. Oh, here we have a Living Well head and neck support group. Well, it's kind of this is not my support group, but this is kind of like what my head and neck support group is like. And I'm guessing that a lot of you know of support groups and perhaps have even been to them. Some have, yeah, a lot of people. And I can really only speak for mine, but I think that it might be typical where we all sit around in a circle and share as patients how we feel about what's going on. And I think in a head and neck support group, like many other cancer support groups, they can be quite emotional. You're often given a chance that you don't have anywhere else as a patient to speak to other patients or people who've been through it who know exactly what you've been through and what you're going through. And that is good because you know that you can get into a bit of detail about what's going on and some of the questions you have, in a level of detail that you perhaps don't have in talking to other medical professionals, your GP or others. And that's true for this group, I think. I think it's also fair and true to say that it can be a place where patients vent their unhappiness with some of the treatment that they believe that they've had. And I think that's fair to say for some of those support groups. And for that reason, it's a really valuable place to pick up on how some patients feel.
And I was invited along to one of these sessions. I went along thinking I'd be there for about 20 minutes, and 2.5 hours later I was still there. It was an incredible experience, actually. The group opened up in a way that I'd never experienced before, and I thought I knew these people pretty well. I'd looked after them through 6 weeks of treatment and recovery. But they raised issues that I'd actually never heard before. They talked about how tired they were, how difficult swallowing had been, how hard it was to integrate back into normal life. But one thing that came up again and again was talking about the mask. They raised issues around the mask, why it needed to be there, how uncomfortable it was during treatment. And they also talked about issues that had cropped up after treatment. They'd been left with, or some of them had been left with claustrophobia. In one case, a woman couldn't bear anything to be close to her face, and that included her husband. So that had incredible issues for her and for her relationship. What I found from sitting and letting these patients talk was that they wanted better information, much like the previous TED talk, and they wanted to improve things for the next group of patients coming along.
Yeah, I remember the day actually it was the evening that Ruth came along to our support group, and I remember that the group were really impressed by that. It's quite unusual for someone who is in Ruth's position to come along to a support group, but we welcomed her. And I remember afterwards that they came away feeling like this, sort of heard. So that was great. I think that what that meant for Ruth possibly is that she received something of an earful. Is that fair, Ruth?
That's fair.
Yeah. Perhaps you can explain that.
Well, the picture probably says it all. I came away with two quite conflicting emotions. On one hand, I felt really honoured and that these people had been able to speak to me so honestly about what they'd experienced and that they trusted me enough to listen to that stuff. But I felt completely overwhelmed. I felt like, I think as nurses, I don't know if there are many nurses in the audience here, but we want to fix things, we want to make it better for people, and we want to do it quickly. And I came away thinking I'm one person, and I don't know how I'm going to fix any of the things that they've raised, particularly around the mask. The mask is an essential part of treatment. The patient has to be held in the same position for treatment every day. There's no way we can get around it. So I'd heard everything they'd had to say, but I didn't know how to fix any of it, and that was really, really hard. So what happened next? Well, started to climb the mountain, and the first thing I did actually, it was the next day, is I went into work and I sat down with one of our radiation oncologists and told him about what the patients had said to me the night before. And he was awesome. He said, when can I go and hear this stuff? When can I meet with this group? So he wanted to experience what I'd experienced, which I found was just coming from a consultant was fantastic. So he went along to the next session. He got an earful also, I think. But it had the same effect on him. It just really motivated him to see how we could improve things for patients. It led to conversations amongst our senior doctors about what we could do, and at that point the idea of making a DVD for patients having head and neck treatment was floated that would go over some of the issues that they'd raised, some of the things that they felt that they hadn't had enough information about. We felt we could, with their help, put into a DVD for patients to look at before treatment started and get some of the information that was missing.
Yeah, and as far as what patients did after that session, I think that it was a binding experience, if you like, to collectively vent and give Ruth an earful, but also to listen to each other. And like many other support groups, ours evolved into a coffee group. You know this? Yeah. And some of the best, I think, patient support groups are coffee groups. We, I think, in the group after that session, I noticed a bit of a change, and they were emailing each other about how they felt things were progressing, and we'd talk about that over coffee as well, and that was really good. And I think that the other thing that did happen, like it or not like it, but Ruth received a lot more active contact from the people who were at that group after that session. Now, I think there are pros and cons with that, but Ruth can speak about that. There's no question, though, that they move from being quite passive, if you like, quite sort of passive, to being very active in their healthcare.
And from my point of view, there were no cons to that. That was fantastic, that people felt they could contact me and we could actually work through some of the issues and worries that they had. So the next thing was a project that Nick and I did, and I'll let Nick talk about that.
Yeah, some of you might be familiar with this. The Commission kicked off and invited the EBD project. Have you heard of this? Yeah, a few. This project was about improving patient experience by design. And if I remember correctly, there was a person over in England, actually, who had kicked this off. Lynn was her name. Is she here? No, right. She might be in the country, though.
Yeah, she's come to live in New Zealand.
She has. She's come to live in New Zealand. Great. I think I heard that. It's very good. She must have been impressed. So, Lynn came over, gave us a bit of a tutorial on this particular approach, and what was different about it was about partnership in healthcare, and it was particularly about observing what was going on in that patient's experience, observing it, and then making a few improvements in partnership, if you like. So, perhaps we might get on to the next bit, describing that, and some quotes.
So with the Partners in Care course, which is the course we attended through the Commission, they talked a lot about recording patient experiences, and this is one of the things we did for our project. We wanted to video some interviews with patients. So we had some very willing participants, and they were so generous with their time. They came in to my office at the hospital early evening or after work when Nick was free, I was free, everything was quiet and peaceful in the department. We had a video camera set up and they just sat down and we let them talk. We had a few questions to guide the conversation, but mostly patients just talked and talked about their experience. And again, just some amazing things came out that we'd never heard before. And this is a quote from a man called Norman. Do you want to read that, Nick?
Yeah, sure, I'll do that. So, in these videos, we had many quotes, but here's one from Norman, and we remember these ones. He said there were two things that surprised me. One was the size of it. He's talking here about the machine, the mask, I should say, the mask. And when you think about the mask, you think quite small. Someone says you're a mask, just covering your face. Whereas the mask that was produced was a big mask that went right down, covering the shoulders. I didn't expect it to be attached to a horizontal position. That was a surprise. Those two things made it hard to cope with initially, from being told I needed a mask to the actual reality of what that meant. So that was Norman. And I think one of the main points here is that he was surprised and how he felt about that. And surprise, if you think about that in that context and everything that's going on for Norman in his life and treatment and everything else, surprise is bad. Yeah.
And that the context of that also is that we, before the mask was made, he'd had it all explained to him what it would involve in words that certainly we thought were clear, but it just shows how our communication, even when we think we're doing a good job, can be far short of what patients actually need. So his comments were really interesting in a number of ways. So then things snowballed. By raising this as an issue, it got people thinking in the department. It raised debate, and some of that was positive, some of it was negative, but regardless, it got people thinking and talking, and I think that's really important when you're trying to raise awareness of an issue. Our doctors, I noticed, just being a quiet observer, started to change their approach to communicating with patients about the mask, showing a lot more compassion and empathy when patients were struggling with it. and feeling claustrophobic on treatment, and really actively asking patients how they were coping with it. And for those who'd had issues after treatment related to the mask, acknowledging those and actually delving in and offering some help for those issues, rather than just sort of putting it out there as something that's in the past, so it shouldn't be an issue anymore. Another of our doctors revisited some patient information that he'd been working on that looked at the side effects, and sent his draft out to a bunch of patients to give feedback on, which it's such a culture shift in our department. It was really lovely to see. Our DVD on head and neck treatment it continues to be in development. What we want the DVD to show is some footage on the mask, talk about the side effects, and most importantly have sound bites from patients who have been through treatment. They've got so much wisdom to offer, so we want this DVD to just incorporate little bites of their wisdom along with the factual information. We've had patients involved all the way through in the writing of the script, and we're planning to have patients involved in the production as well, which is really exciting. Our barrier at the moment is funding, which anyone who works in health will understand, but we're determined to keep working on that and seeing it through. So it's been incredibly positive. So what have we learned? Well, for me as a nurse, as a health professional, I've learnt that it's okay to be challenged. It's in fact good to be challenged. Patients want to help, and that's not something to feel threatened by or feel like you're being criticised. I don't believe it was ever the intention of the support group to criticise what we as a team had done for them in our care for them, but they were wanting to help the next group of patients coming along and make things better for the next group. And that's something that we just need to embrace. It's not something to be feared. In my own practice, I wouldn't dream now of trying to change something that affects patients without actually asking patients first. From doing this course, it's just made such a shift in my thinking, which I'm really thankful for. And I've also learnt that it takes a long time for culture in a department to shift, but even as one person, you can still make a difference, and it's worth still putting your energy into that because it pays off, and the patients really, really appreciate being heard. So take a risk. Ask patients what they have to say, what feedback they can bring. I often sit down with patients at the end of their treatment or partway through their recovery and say, what could we have done differently to help you? And you just get some fantastic information from them.
I think as a patient, it is about climbing together. There's a lot of distress when you are a patient. We don't lack emotion in healthcare, and sometimes that distress is hidden, it's hidden. And I think what that requires of us is to be very open with each other, together, but healthcare professionals obviously being open with patients and each other, but also patients being open about how they feel and what they know and what they need to know. And I think if we work together on that, we can move from a stage of distress to something where we're working together to improve the situation for everybody on both sides, And I think that is inspiring. So thank you.